The Differential Diagnosis of Warm Diseases, by the Qing Dynasty physician Wu Tang. Chapter 2, Upper Jiao Section, Sections 24 to 27, English. Section 24. The addition of Xiang Ru Decoction, used for treating Tai Yin hand summer heat syndrome, which presents similar symptoms to those mentioned above, but the patient cannot expel sweat to the surface. Symptoms resemble those of cold damage disease. The right pulse is large and strong, the left pulse is relatively smaller, the complexion is flushed, there is thirst, and speech is impeded. However, since sweat cannot appear on the body surface, Xiang Ru Decoction is needed to disseminate the summer heat evil on the surface. Xiang Ru possesses a warm and pungent nature, with a fragrant aroma, which can act on the lung meridian to affect the body surface. Bian is a flower with a fragrant aroma that can protect the lungs' fluids, because flowers disperse more easily than beans, avoiding respiratory system blockage. Many plants that grow in the summer have heat-clearing properties, but Bian is the best choice. If Bian is unavailable, fresh Bian skin can be used, and if that's not available either, the raw skin of Bian can be used. Hupo has a bitter taste and warm nature, capable of purging fullness in the body. It is also related to the lungs' control over the skin. Therefore, in this case, Hupo is used not only to treat middle jiao issues, but also to address skin problems. Huang Lian and Gan Cao are both natural herbs that are usually not needed for initial summer heat symptoms, because they may guide pathogenic factors deeper into the body. Therefore, we prefer to use Jinhua and Lian Tiao, both of which have a pungent and cooling nature, to disperse the pathogenic factors on the lung's surface, without the need to penetrate deep inside. When treating summer heat disease, it is best to avoid excessive use of pungent and warm-natured herbs, because summer heat often accompanies dampness, which belongs to yin pathogenic factors, and requires pungent and warm-natured herbs to disperse. Hence, this prescription uses Xiang Ru and Hupo with their pungent and warm properties, supplemented by Jinhua and Lian Qiao with their pungent and cooling properties, to ensure the effective dispersion of pathogenic factors on the surface. The specific formula for the Xiang Ru decoction is as follows: Xiang Ru 2G, Jinhua 3G, Bian 3G, Hupo 2G, Lian Qiao 2G. Boil with 5 cups of water until 2 cups remain. Initially, drink 1 cup, wait for sweating, and then continue drinking. If sweating does not occur, you can drink again until the symptoms improve. If sweating still does not occur after taking the decoction, you can prepare and drink it again. Section 25. In cases of Tai Yin hand summer heat syndrome, if slight sweating occurs after taking Xiang Ru decoction, it should not be taken again, because inducing further sweating can harm the body's surface, leading to the injury of both qi and blood inside, ultimately resulting in surface weakness. Even if other symptoms persist, treatment methods should be based on the condition of which meridian is affected. It should be noted that cold damage disease often requires sweating to dispel heat, while wind cold is not suitable for inducing sweating and only requires relief of muscle spasms. This is the difference in treatment methods, and the treatment principles differ as well. Similarly, warm diseases need sweating to resolve the illness, but excessive sweating should be avoided, and pungent warm herbs should not be used. The key is to guide pathogenic factors out of the body, allowing the balance of nutrients and protective qi and blood to naturally result in sweating, without forcibly inducing profuse sweating. However, the situation is different for summer heat and damp heat diseases. In cases of summer heat diseases, sweating is usually helpful in relieving heat, so Xiang Ru decoction can be used to induce sweating. But once sweating begins, if it does not stop, the Baihu method should be employed to prevent excessive loss of bodily fluids. This is different from cold damage and wind cold diseases, where continuous sweating is not advisable, and frequent weakening of the body surface should be avoided to prevent issues such as syncope. Ancient medical practitioners had a method for treating summer heat diseases called the Qing method, and its treatment principles also have their merits. Section 26. In cases of Tai-Yin hand summer heat syndrome, whether sweating has already occurred or not, but sweating continues with symptoms of restlessness, thirst, and rapid breathing, and a strong and forceful pulse, you can use Bai Hu Tang for treatment. If the pulse is strong and forceful with nodules, you can use Bai Hu Jiao Ren Shen Tang. If the patient feels a heaviness in the body, possibly accompanied by dampness, you can use Bai Hu Jiao Kang Zhu Tang. If there is profuse sweating, a scattered pulse, and wheezing while drinking, you can consider using Xing San. The formula for Bai Hu Jiao Kang Zhu Tang involves adding 3g of Kang Zhu to Bai Hu Tang. Xing San employs a method of sourness and sweetness to nourish yin, and includes 3g of Ren Shen, 2g of Mai Dong unprocessed, and 1g of Wu Wei Zi. It should be decocted with 3 cups of water until it reduces to 2/8 of a cup, divided into 2 doses, with the residue decocted again. If the pulse has not reduced in size, it can be taken again, depending on the pulse reduction. If there is excessive sweating, a scattered pulse, indicating a loss of yang qi, and internal weakness unable to retain yang qi, the Xing San method of sourness and sweetness is used to preserve yin to retain yang naturally. Ginseng, as the main ingredient, is used to replenish the vital energy of the lungs. Section 27. In cases of Tai-Yin hand summer heat syndrome, after sweating therapy, most of the summer heat symptoms have alleviated, but there remains a slight swelling in the head, blurry vision, and residual pathogenic factors within the body. You can use Qing Luo Yin for treatment. If the pathogenic factors are not completely dispelled and have entered the middle and lower jiao, then treatment methods targeting the middle and lower jiao are needed. Since it is residual pathogenic factors, it is not advisable to use strong medicines, rather, lung cleansing and collaterals clearing herbs with aromatic and gentle properties are sufficient. If the condition is deeper and affects the middle and lower jiao, superficial medicines should not be used for treatment. Qing Luo Yin employs a therapy of pungent coolness and aromatics, with ingredients including 2g of fresh lotus leaf margin, 2g of fresh honeysuckle, 2g of watermelon rind, 1g of fresh Bian dohua cowpea flour, 2g of loofah peel, and 2g of fresh bamboo leaf heart. It should be boiled with 2 cups of water until it reduces to 1 cup, divided into 2 doses, taken twice daily. This prescription is suitable for mild cases of lung qi damage due to summer heat, but it is not suitable for deeper conditions involving the middle and lower jiao. Note: in modern medicine, Qing Luo Yin is not a commonly used therapeutic formula. This prescription is primarily based on ancient medical theory, and its effectiveness varies among individuals. Further validation is needed through clinical practice. To be continued.